I'm Wendy Williams. I am the preschool teacher at the Child Development Center. The MTSU Child Development Center gives students who wish to be early childhood educators the opportunity to work with children from ages 1 to 5. We offer an infant-toddler program for children ages 1 to 3 and a preschool program for children ages 3 to 5. We are a 3-star quality program and are evaluated by the Department of Human Services, or DHS. We follow DHS standards in our program. We are also NAEYC accredited and follow national standards for high quality and best practices. NAEYC stands for the National Association for the Education of Young Children. This video is going to focus on how we at the Child Development Center maintain a healthy environment as well as health concerns that may happen in a child care facility. In order to maintain a healthy center, we must follow certain standards. A few of these standards are: avoid close contact with those who are sick. Stay home when you are sick. If you are vomiting or running a fever, you should not come to school. Cover your nose and mouth when you sneeze or cough. Wash your hands with soap and water after you sneeze or cough. You also will wash your hands when you enter the room, just as the children do. Avoid touching your eyes, nose, and mouth while working with children. These areas carry germs. Drink plenty of fluids. You may bring a bottle of water into the lab and place out of the reach of children. We do not bring sodas or coffee into the classroom. Eat nutritious food. We encourage you to eat snack with the children so that they can see an adult make healthy choices. One common childhood disease we need to tell you about is CMV. It stands for cytomegalovirus. This is similar to chickenpox. It can be serious to infants, pregnant women, and elderly people. Anyone can be affected. Most people have been exposed by adulthood. If you are alive, you have felt some sort of stress in your life. People deal with it in a variety of ways. Causes of stress are homework and school projects, family tension, conflict with others, not enough sleep, too much to do in a little amount of time. Symptoms of stress are rapid heartbeat, flushed face, forgetfulness, feeling sick to your stomach. Stress reduction can happen if you exercise, take a break, sleep, journal your feelings, and take time to meditate. SIDS, or sudden infant death syndrome, is the sudden, unexplained death of a child younger than 1 year of age. SUDS, or sudden, unexplained death syndrome, is the unexplained death of children younger than 5 years of age. This diagnosis is given when all other diagnoses are ruled out and the death of the child is not explained after an autopsy. We do not have infants, but it is important to note that state guidelines require that sleeping infants be put on their backs. We do not have nap time, but sometimes children fall asleep in our care. We place them on a nap mat on their backs. Parents could prevent this by providing the baby with a smoke-free surrounding. MTSU is a smoke-free campus. We even ask that students who do smoke change their clothes to fresh clothes before coming to lab. Researchers believe stale smoke or air contributes to SIDS. Parents should use the correct bedding. They cannot use heavy blankets or bumper pads. Parents should not overdress their baby while they sleep. It is important for a baby to have regular checkups with the doctor. In the infant-toddler room, it is important to understand choke tubes. If an item fits in a choke tube, it is a choking hazard to young children who are birthed to 3 years of age. These items cannot be brought into the infant-toddler classroom. Choking hazards would include small counting bears, small Lego-type bricks, beads. Many foods are choking hazards. Please ask the classroom teacher if you are concerned or have a question about snack items. The well-being assessment will be discussed next. When the children arrive at school each day, we are required to do a well-being assessment check. This is done by checking children for bruises, scrapes, and bumps. If a child has one of these conditions, you may say something like this to the child or parent. I see you have a bump or boo-boo on your arm. What happened? This lets the parent know it was there before school started and that we are concerned about the child. If we see a pattern of this condition, we have to consider there may be something else going on. Please report to the master teacher any concerns you may have. In the well-being assessment, you also check for open sores on the body, fever, green nasal discharge, and head lice. All this is done quickly without a great deal of fanfare. Look the child over and touch the child's back to determine if there is a fever. Make sure you complete this practice every time you are required to greet the children. If a child seems ill at the well-being assessment, please let the master teacher or director know immediately. Children who are sick will not be allowed to come to school. This rule is put in place to protect the health of staff and other children. It is important to note that part of the children's well-being depends on you. Please remember that all of your paperwork, including fingerprints, must be turned in before you can work with children. This is a DHS rule.